Hi, everyone. I'm Becky McGregor, your APS Employee Wellness Coordinator, and with me today is Amanda Romero from Blue Cross Blue Shield of New Mexico. She's going to deliver your Blue Cross Blue Shield benefits for 2026. So we just want to remind everyone that open switch enrollment is October 1st through the 16th, 2025, for your benefits starting January 1, 2026. This presentation also serves all new employees for the calendar year of 2026. So with that, I'm just going to take myself off, and Amanda, you can take it away.
All right. Awesome, Becky. Thank you so much. Thank you, everyone, for your time in reviewing your Blue Cross Blue Shield APS benefits. Today, we're going to go over the benefits that are available to you for the 2026 plan year. On the next slide, you are going to see the agenda. On the agenda today, through the presentation, we are going to review your plan features that are available to you as a Blue Cross Blue Shield APS member. We're going to go over customer service, online tools and resources, as well as health and wellness programs that are available to you as a Blue Cross Blue Shield APS member. So Blue Cross Blue Shield has a variety of different doctors and hospitals that are in network available to you. Blue Cross Blue Shield has a nationwide network, so you can have coverage anywhere you go. As an APS employee with Blue Cross Blue Shield, you do have personalized customer service, health and wellness programs, tools and resources, as well as digital capabilities, which we will go over through the presentation. As an APS employee, we know you have different plans to choose from. So here are some ways and items that we suggest you look at when you are trying to consider what plan is best for you. We know that every employee and every family has their own unique needs, but here are some items on what to think about. Look at provider availability. See which doctors you need to see or would like to see, any hospitals and facilities that you'll want to see in network. You'll also want to evaluate your costs. How much is going to be coming out of your paycheck just to have insurance, and then also look at the benefits. How much will be taken out if you do go to be seen by a provider? So your co-pays and your co-insurance. And then also evaluate all the medical services that you will be receiving and consider those costs as well. Your Blue Cross Blue Shield plan is an EPO plan. So what that means is exclusive provider organization. You have nationwide coverage in network. You have an in-network only plan. So what that means is you have access nationwide, and as long as you see a Blue Cross Blue Shield provider, you're going to have in-network coverage. There's so many advantages to seeing an in-network provider. You're going to receive the highest level of benefits. You're going to have protection from billing or over allowed amounts. You don't have to fill out any claim forms. No referrals are required, and you do not have to pick a PCP. On the next slide here, you are going to see a snapshot of some of the most utilized benefits. As an APS employee and Blue Cross Blue Shield member, if you're currently on the plan, there are no changes from 2025 to 2026. Your deductibles will remain the same. If you're enrolled employee only, it's going to be $1,000. Employee plus one is $2,000, and employee plus two or more is going to be $2,500. The deductible only applies to certain services, such as inpatient and hospital surgery. So you'll see there anywhere it's notated on this screen and it has an asterisk, that is when the deductible applies. Other than that, the deductible does not have to be met first. You'll also see your out-of-pocket maximum. If you're enrolled employee only, it's going to be $5,000. Employee plus one is $10,000, and employee plus two or more is $12,500. Your out-of-pocket max is the most that you are going to pay for covered medical benefits on your plan for a calendar year. Once you meet your out-of-pocket max, all of your covered services are covered at 100% for the remainder of the year. Everything accumulates towards your out-of-pocket max, such as your deductibles, your co-pays, and any co-insurance that you pay. Your co-insurance is 20%. So you will see that here on the slide, it will notate any time your co-insurance applies. So for example, on your outpatient and inpatient facility costs, It says 20% and it has an asterisk. Those are going to be covered once you pay your deductible. You're going to pay 20% coinsurance. So 20% of the bill, your insurance will cover 80% of the bill until you meet your out-of-pocket maximum. Preventative services are covered at 100%. Your COVID treatment will be covered based on place of type and treatment, type of service and treatment. Your MD Live, which are your virtual visits, are going to be covered at 100%. Your mental health visits are covered at 100%. Primary care visits, $30 copay, specialist $60. Allergy office testing and treatment is $60. Allergy extract prep, serum, and injections are a $10 copay. Lab x-rays and EKGs are covered after a $30 copay per day. MRIs, PET, and CT scans are going to be covered at a $120 copay per day if you get these services done at a freestanding imaging center. If you get those done at a hospital, it's going to be 20% after deductible. Urgent care is a $75 copay and emergency room is a $450 copay. So now on the next slide, let's talk about how to find a provider. You are able to find an in-network provider by utilizing our Provider Finder tool. On the Provider Finder tool, you can access this on the website as well as through Blue Access for members. And on here, you can find in-network doctors, medical groups, hospitals, and urgent care, no matter where you are. So if you're traveling and you need to find a doctor near you, you can utilize Provider Finder, input the zip code, and it will input any providers that are in your network that are near you. You're also able to compare quality ratings, read and write reviews, as well as use the cost estimator tool. There's another way on the next slide how to find providers. As an APS member, you all do have this concierge service. So from your computer or mobile device, you can log on to bcbsnm.com/APS and click on doctors and hospitals. And that's how you can access Provider Finder. However, you can also call the concierge teams from Optum and Loveless Medical Group when you need help finding a PCP or a specialist. Just let them know that you are an APS employee or member, and they can assist you in getting an appointment and finding a provider. The numbers are here on the screen. I encourage you to put these in your phone, write them down, just you never know when you're going to need help finding a provider. On the next slide, we talked a little bit about the cost estimator tool, which is located in Provider Finder. So the cost estimator tool is a really great tool that is available to you to look at the different estimates of different facilities for a certain service. This can help you plan for future services as well as identify what your out-of-pocket costs may be. So for example, on the slide here, it is looking at a cost estimate for a joint repair, either a hip or knee replacement. It's going to show you what the cost is. So for what the estimated cost is. So for example, here it's showing you what the estimated cost would be if you get it done at Loveless Westside Hospital. You can also utilize the add to compare box there, and you can compare it to other facilities. And then there you can see that it shows you your estimated cost of $5,500. This is just an example. It will apply your benefits as an APS member based on what your benefits are on your APS Blue Cross Blue Shield medical plan. You can also view the ratings. So you can see here it does show you the ratings of this hospital as well. So a really great tool to utilize to see what services are available and what the cost may be if you have to get them at a different facility. On the next slide is your MD Live service. So this is your access to a provider 24/7, 365 days a year. This is available to you and any members that are covered under your plan. This gives you access to board certified physicians for any non-emergent needs. So if you have pink eye, upper respiratory infection, a cold, flu, anything like that, you can contact MD Live 24/7, 365, and they're able to treat and diagnose you. They can talk to you over the phone, they can do a video visit, or you can also schedule an appointment at what's convenient for you. This is a great way for you to get seen, a convenient way and a very inexpensive way, as the MD Live is no cost. As many times as you utilize it, there's no cost to you. The other virtual option you have, and this is available today, you do not have to wait till January 1. This is available is Galileo. This is a virtual primary care provider and virtual specialists. So this gives you access to those providers virtually, so very convenient. You'll be able to see a primary care provider, so if you don't have one, they can be your established PCP, or you can see different specialists as well. Some of the disciplines or specialists that are available are psychiatrists, any infectious disease, HIV, pediatrics, cardiology, sports medicine, and women's health. There's over 20 different disciplines that are available within Galileo, and this is a great way for you to get seen virtually and conveniently. A lot of the times you're able to get an appointment the same day. To get started, or the way that it works is you just consult with your medical expert. If you are doing a PCP visit, they can order all of your lab work and then they will go over it with you. And then they can also request referrals for you. So if you need a referral for a service or anything like that, and they can also help with prescribing medications. They can help with your maintenance medications as well. On the next slide, it shows you how to get started. So you can scan the QR code or visit galileo.health/bcbsnm.com. You'll create an account. You can download the app so that it's convenient for you to access anytime. And then it will prompt you if you want to get services that day as well. But it's a great way for you to get seen by a PCP and specialist virtually and conveniently. The cost for that is going to be your PCP copay, and then if you see a specialist, it'll be your specialist copay. Here on this slide is your digital mental health Learn to Live. This is your digital mental health program that is available to you. It's available 24/7, 365. This gives you access to online programs and services for proven therapy techniques. You get access to personal coaching by phone, text, or email, or you just get access, or you can have access to different resources as well. This is a great private and convenient way to get help for any mental health concerns such as depression, resilience, social anxiety, and substance abuse. This is available to all Blue Cross Blue Shield members and their family members that are 13 years and older. As much as you utilize this service, it is no cost to you. It is a value-added benefit under your APS Blue Cross Blue Shield plan. I have mentioned a couple times Blue Access for Members. Blue Access for Members is your personal portal within Blue Cross Blue Shield. This is your portal where you are able to look at your personal information with Blue Cross Blue Shield. It'll give you the ability to download or request a new ID card. You can look at claims, you can find a provider, you can confirm healthcare benefit information, as well as update your preferences and to go paperless. This is available for you to log in anytime, and it's secure access 24/7. To sign up for Blue Access for members, you can log on to the website at bcbsnm.com and you can create a login. You will need your ID number, so make sure that you have that handy. And once you log in, you'll have access to all of the resources that are available to you on your Blue Cross Blue Shield plan. You also have the ability to download the app. On the next slide, it shows you a snapshot of what the app looks like. On the app, you're able to do a lot of the same things that you can do on the website. It also has the ability to find an in-network provider, access your claims, look at where your deductibles and out-of-pocket maximums are, and you can also have your digital ID card so you don't have to carry around your physical ID card. Prior authorizations. So prior authorization is a process used to determine whether a medical service meets the requirements for your health plan coverage. It is very important as a member for you to know what services require a prior authorization. You will need to get a prior authorization for certain types of services. This could be some hospital stays, any specialty drugs, any drugs that you get through your pharmacy vendor. Express Scripts may require a prior authorization, and then some services that you get outside of the hospital. Your provider can help you with requesting the prior authorization. For a full list of any services that require a prior authorization, you can obtain the benefit booklet that is available in your Blue Access for Members account. Now let's talk about your wellness tools that are available to you. You have Well on Target, which is your wellness portal. This is going to encompass all of your wellness programs that are available to you and your resources, and we'll go more in depth here on the next slides. Also, your digital mental health supports your mental health well-being, as well as any programs for stress, depression, and sleep problems. So on here, you can see what your member wellness portal looks like. You will have access to a variety of different items within your wellness portal, such as your health assessment. You're going to have access to interactive coaching programs, as well as the fitness program, as well as any Blue Point redemption items. So we'll talk about that here shortly. On the next slide, you can see here your health assessment. The health assessment is a great way for you to get started on improving your health. Within the health assessment, it is integrated within your portal. You can also do this from your phone on the wellness app, which we'll talk about here shortly. This is a way for you to get some recommendations on what you can do to enhance your health. So it recommends different self-management programs and coaching, as well as provides a personal wellness report on and provides health improvement tips. Here's a list of some of the self-management programs that are available to you. There are some interactive ones, which include managing your stress, quitting tobacco, improving your blood pressure. And then there's educational self-management programs, such as preventing diabetes, healthy bones and joints, as well as healthy pregnancy. These are all located in the Well on Target Wellness portal that is integrated within your Blue Access for members. And then Blue Points. This is a great way to entice you to do healthy habits. So you have the ability to earn Blue Points and redeem them for gift cards. The way that you can earn Blue Points is by doing healthy activities, such as completing your health assessment, doing any of the digital self-management programs, enrolling in the fitness program, syncing a tracker, and just doing anything that is related to your health. There's a variety of different options that are available to you on your wellness portal that help you earn these Blue Points. And then with these Blue Points, as you earn them, you're eligible to redeem them for gift cards. There's a variety of different gift cards for you to choose from, but it's just a great way for you to do healthy activities as well as get rewarded for those healthy activities. I talked about the wellness app. So the wellness app is your always on app. So this is a mobile app where you're able to access that health assessment from your phone. You're also able to do some secured messaging with a health coach. Let's say that you need assistance on nutrition advice or anything like that. The health coach can assist you. This also has different recommendations and tips for you on healthy activities that you could do. It recommends different digital programs for you to do. And within that, you're able to earn the Blue Points as you participate in this app. You can also look at your Blue Points balance, and then you can also redeem your gift cards through here as well. As a Blue Cross Blue Shield member, you do have access to our flexible gym program. This is our flexible gym network. It gives you a choice of gym networks that fits the budget and preferences of you. You will see here there's classic and then there's luxury. And then under those are different tiers that you can choose from. You can see under classic, there's the base tier, the core tier, and the power tier. Each of these tiers, you can see here what the cost is per month. There is an initial one-time enrollment fee of $19. Once you pay that initial fee, your monthly cost will be based on whatever tier that you elect. You will see here that the tiers and the cost increase as the number of gyms in network increase. So for example, on the base plan, there are 3,500 gyms nationwide. Locally, I listed some of the gyms that are available, which is Choose Fitness and Planet Fitness. If you were to go to the core plan, you will see there that there's 8,500 gyms nationwide, 8,500 or more, as well as I listed some of the local gyms that are available, which is PowerFlex, Body Mass Foundation, New Heart, Vessel Health, Crunch Fitness. Keep in mind, this is just a limited list. There, you can look at the full list online. And then the power list includes 13,000 or more gyms, and then you can see there's some of the local gyms. As you go up in tiers, the tiers that are below those gyms are included. So for example, on the power tier, any gyms that are in the core tier and the base tier are in the power tier. These gyms are nationwide, as I mentioned, as well as locally. So you have the ability to access these gyms as many times as you want. And when you're traveling, you have the ability to have access to gyms when you're traveling as well. So if there is a gym that is in network near you, you're traveling and you wanted to access the gym that's down the street, they're in network, use your Blue Cross Blue Shield ID card and you are able to enter that gym because you have a membership with them through Blue Cross Blue Shield on your flexible gym network program. You also have the ability to do digital fitness programs. This is through Burn Along. This gives you the ability to have access to workouts digitally 24/7, 365. That is through Burn Along. And then you have the ability to have studio class rewards. So this gives you 30% off every 10th class. And I listed there some of the local studios that you can benefit from this discount. Just for being a Blue Cross Blue Shield member, you have access to the Blue 365 discount program. What this is just a tab in your Blue Access for members, or you can go onto www.blue365deals.com/BCBSNM and you can look at the variety of different discounts that are available. Who doesn't like discounts? Who doesn't like coupons? On here, I encourage you, whatever it may be, just go on there and peek. You never know what you're going to find. There's different discounts for healthy eating. There's like Jenny Craig, there's dental, there's vision discounts. There's also different family activities, fitness gear. The list goes on. So definitely check it out as those do change frequently. And then Wonder. Wonder is your weight management program that is available to you at no cost. With Wonder, this provides you personal coaching. It is a 13-week program. It helps you and learn a new way of having a good relationship with food and eating. This program is a skills-based digital weight loss program, and it teaches you how to enjoy the foods that you love, but improve your overall health. To get started, you can go to wonderhealth.com/APS. This is available to you now, and like I said, it's no cost to you, so you can get started today. Women's and Family Health Program is currently with Ovia in 2025. It will be moving to Maven. Maven is our new partner, and we are so excited to have Maven as it's going to bring a variety of different options and enhancements to our Women's and Family Health Program. Within Maven, you're going to have access to 24/7 virtual support, as well as one-on-one access to coaching or a provider if need be for women's health. You have access to this provides you support no matter what stage you are in your life's journey. So you can be in the family building stage, the pregnancy stage, postpartum, parenting, or menopause. As I mentioned, this provides you one-on-one support, and it is a great program that will be available January 1. We know when getting a cancer diagnosis can change your life forever, and it is very just all of the items that you have to think of. Because of this, we want to provide you support. So there is a customer or a cancer service and support program that is available on your plan. All you have to do is call the customer service number on the back of your ID card, and you can get this support. Our cancer support gives you access to skilled cancer care nurses. They can help you prepare for any appointments that you have, help you come up with any questions, review any results, go more in depth if you have questions questions after your appointment that you may not have been able to ask your doctor, but they're here to support you. So that's one way. And then the other part of this is the expert review and support. So this is if you are actively undergoing any treatment or a cancer survivor, you can ask that a medical expert review your case, and this allows you to get expert recommendations on any next steps, or just make sure that everything is that you are getting the care that you need, or provide any opinions or anything like that for you to go on, ask your doctors. So a great program, and as I mentioned, you can access this by calling the number on the back of your ID card, which is your customer service. So I know that was a lot of information, and medical insurance is so complex, but in order to be a smart consumer, here are some tips and tricks to follow. So always use in-network providers. You have a large nationwide network, so try to see an in-network provider every time that you go and seek services to help keep your out-of-pocket costs to a minimum. Review your explanation benefits and your bills. Make sure that they match and that they're being covered based on what your plan's intent is. Use your wellness benefits. Use that always on program. Gain those blue points. Get redemption. Get gift cards for healthy activities. See your physician regularly. Ask your healthcare provider those questions, and you can visit bcbsnm.com/APS for all of your health and wellness items that we went over today, to get access to all of your Blue Cross Blue Shield programs. Here is the number to customer service. This is also the number that is on the back of your ID card. You can call customer service and they can assist you with any claims. So if you get a bill and your explanation of benefits and you don't know what it means, you don't think you should have been billed something, they're able to assist you. They can help you with finding an in-network provider. They can go over your navigational digital tools and resources that we went over, and they can also help with requesting an ID card. I appreciate you taking the time to review your Blue Cross Blue Shield benefits for 2026, and we look forward to serving you.
There we go. Sorry, everybody. All right, I was not unclicking. Thank you so much, Amanda, for that excellent presentation on Blue Cross Blue Shield. Everyone, we appreciate your time learning about your benefits that you have available to you under APS. We want to remind you once again that the open switch enrollment timeframe is October 1st through the 16th of 2025 for your benefits starting January 2026. If you have any questions about your benefits, we do have the Employee Wellness Fair, and that is October 7th and 8th, 2:30 to 6 p.m. at Bonifacio. It is an excellent place for you to get all of your questions answered around medical, dental, vision, pharmacy benefits. We also have a vaccine event. We have biometric screens. Blue Cross Blue Shield will be there with their their care van, which is a very cool van, and they're going to be doing biometric screens. And Blue Cross Blue Shield representatives will be there to answer all your questions. It's truly the best place to get all of your questions answered and also receive preventive health care services. So we want to thank you all. More information is in the description below. And thank you, Amanda, once again.